I think we might get started. We've got a fair number of people have joined us. So welcome, Kristin. Welcome everybody who's joining us for tonight's webinar. We're really excited to be welcoming Kristin Dean, who's an amazing physiotherapist from Sydney with Equimotion, and you're both a human and equine physiotherapist. And I've known Kristin for actually quite a while. We've got a lot of mutual clients, and watching Kristin and Emma, who's your business partner, work on horses and really seeing the change in them has been fabulous. Just really fabulous. And it helps my job as a saddle fitter as well. So welcome, Kristin. Thank you. And why don't you tell us a little bit about yourself and what you're up to at the moment?
Sure. Well, thank you for inviting me to do this tonight, and for everyone who's chosen to spend their Friday night listening to Equine Rehab. I hope that I can give you some interesting things to take away. But yeah, as Paula said, I am a human and equine physiotherapist. So I graduated from the University of Sydney in about 2005 as a human physio, and worked for quite a number of years in kind of private practice, mostly specialising in musculoskeletal and sports physiotherapy. And then kind of transitioned to doing postgraduate study to work with animals, particularly horses as well. So as Paula mentioned, I am one of the co-founders of a business called Equimotion, which is based in Sydney. And we physiotherapy practice, but we really kind of specialise in equine rehabilitation and biomechanics. Is probably our main interests in clinical practice.
Yeah, and I know that you've been doing some amazing research as well. Because you guys have published papers in the past, is that correct? I remember a show.
Working on something at the moment. So we're working on a research paper looking at back movement in horses, seeing if we can quantify that using inertial motion units, which I'm going to talk a little bit about what they are in the talk tonight. Yes, haven't published anything yet, but we are working on it.
That's super. Well, we might get started. I think that we've got a good number of people who've joined us. So I'm going to mute myself, Kristin, because I think I've got a big black Labrador who's scared of rain, and he's just sitting out that door wanting to have a big woof. So take it away, Kristin. I can't wait to see what you've got to share with us tonight.
Sure. All right. Thanks, Paula. Okay, so as I said, thank you for joining us to listen to my talk tonight about equine rehabilitation. This is a really huge topic, and so it's not easy to cover everything off in an hour, but I hope just to give you a good general overview tonight of what equine rehabilitation is, and give you some really good practical examples of what we do in a rehab program and how we structure it. And I've got a case study to share with you as well, so we can see some real life examples of that. I've structured tonight's talk so it's really accessible for everyone. So for those of you who don't know anything about equine rehab, I hope that you'll learn a lot. Those of you who already know a little about equine rehab, some of this may be a little bit of a refresher for you, but I also hope that there's going to be some new things in here that you will be able to take away as well. All right, so in a very basic summary, what is equine rehab? So it's simply a step-by-step process that aims to help recovery. And the things that it might aim to do is to get your horse moving again, regain their strength, improve mobility, or involve lifestyle changes. Because sometimes we may not be able to get your horse back to where they were before, but we should be able to implement some changes to give them a better quality of life. And so the overall aim is to help improve pain, function, movement, and in some cases, we want to even get that horse performing better than it was before. All right, so there's really strong evidence in the human world for exercise therapy in the treatment of musculoskeletal conditions. So when I say musculoskeletal, I mean basically any injury or problem that affects the soft tissues or bone type things. So muscle, tendon, ligament, bony, joint pathology, that's what we mean when we say musculoskeletal. Now, there's not a lot of research in the equine world, but it is growing, which is really exciting. So when I talk about rehab tonight, that's what I'm going to be talking about. So how we can implement exercise in your horse's rehab plan. And it would be great if we could get them in the gym like this picture, but we have to be a little bit more creative. All right, so big slide. I realize there's a lot of information on here, but this is basically the step-by-step process that we take when we design a rehab plan. So the first step is diagnosis. Now, in animals, this is a clinical diagnosis. So in telling you, for example, your horse has kissing spines or it has a tendon injury, can only legally be done by a vet. So your physio, your massage therapist, anyone else cannot actually legally give you a clinical diagnosis. And that's across Australia. What we can give you as a physio is what we call, or another practitioner, is a functional diagnosis. So that usually relates to a movement problem. So we might say, your horse looks like it's moving a little asymmetrically on one leg, or there's a restriction in its bend one way or another. And based on a lot of those functional findings, we can then still design a program around that. Because a lot of you may know, if you've had a horse that's had to go through the process of vet diagnostics, one, it can be really difficult to get to a diagnosis. We can't put a horse through an MRI machine really simply like we can a human. It's also really costly. And I'm sure a lot of you have come up spending thousands and thousands of dollars on vet diagnostics, and sometimes we still can't get an answer. So it's challenging in horses, but we want to, as much as we can, have a vet involved and try and get to a diagnosis if we can. Our next step is goal setting. So what are we wanting to achieve in our rehab? And this is a really important step, and I think that sometimes we can skip over it a little bit, but having a conversation with you, the owner, about what your goals are for your horse. And then I think it's really important for your practitioner to talk to you about, is a full recovery likely, or will there need to be lifestyle or discipline changes? And having those conversations up front so that your expectations, we understand your expectations, and you're not going to be disappointed in the potential outcome of your rehab. I think it's also really important to be honest with your practitioner about your ability to commit to rehab as well. Because we will have some owners who will have their horses at home. They may have a job where they're around a lot, or their job may actually be that they're a professional rider or trainer. So they have a lot of time to commit to your rehab plan. Or you may be an owner who adjusts your horse somewhere. You can only get there a couple of nights a week. It's winter and you need to ride in the arena under floodlights. So the rehab plan that we will prescribe for a person in that situation may look very different to the rehab plan for someone else. And we want to make sure that we set every owner up to succeed in their rehab and every horse. And so that's a really important part, to make sure that we design the program that's not only best for your horse, that's also best for you as well. Okay, then we move on to program design. So I've listed lots of things here, and I'm going to explain these all in more detail soon, but we look at things like strength, we look at load management. So that's basically about the intensity and workload, and that's a really important thing that we have to manage in a rehab plan. We've got mobility or flexibility, cardiovascular training, so aerobic fitness or fitness, proprioceptive training. I'm going to explain that in a little bit more detail, so I'll come back to that one later. And then also we've got discipline-specific training if we've got performance horses or even race horses. As I mentioned before, I think education of our owners and riders, because for us, we see the owner and rider as an integral part of the rehab program. So our job is to help guide you through the process to make it to get the outcomes that you're looking for, because obviously we can't be there every day to help you with the rehab plan. So our goal really is to guide you and educate you in helping you to perform it. Then we need to look at ways that we can measure progress. And so this helps us to amend or progress the program. And we should make that objective where possible. So by that, I mean, it should be something that we can measure. So rather than you just thinking, oh, I think my horse seems like it's a little bit better this week, how can we give you ways to put a measure, put a number against something so you can see the improvements happening? And that's a really important part. And then we've also got pain management. parameters to look at as well. So that can be things such as medication, that may be manual therapy, electrotherapy. But I think it's also really important to acknowledge that exercise plays a really important role in pain management as well. So if you've ever had a back injury or something yourself, often you'll know that, going for a walk or doing some gentle exercise is often one of the things that can help you feel a little bit better. Okay, and then the other probably really important piece of information when it comes to rehab is that it should be a team approach. And we can see Paula in the top corner there as well. And look, this is not an exhaustive list at all. These are just some people that we have worked with in our rehab plans. There may be others as well. But I think the really important thing to take away is that there is no one practitioner that can do everything. I'd like to think I'm pretty good at the physio rehab program design, but certainly the other areas that I've listed there are certainly not my area of expertise. And so I would rely quite heavily on those people to help me in the whole rehab progress so we can give the horse the best chances possible. All right. Let's look a little bit more closely at some of those parameters I mentioned before. So the first one is strengthening. So basically we use strengthening exercises to improve neuromuscular control and to strengthen muscle and tissue, essentially. And our overall aim is to adapt the horse to the demands of performance. Now, strength in horses is really difficult to objectively measure. In a human, we can do things like get them to lift weights or use special machines to measure how much force their muscle generates. We can't really do that in a horse. So often it's determined by its ability to perform the required tasks. And we may also look at muscle size and symmetry as well. All right, so when it comes to strengthening, we want to apply something called the overload principle. And probably the best way you can think of that is actually just looking at that picture. So basically what the definition is that a muscle must be progressively loaded in order to gain increases in strength, power, or endurance. So if we look at our little guy here on the left, he's pretty puny looking and he's holding a pretty small weight. Now, if he only lifted a weight of that size, he's probably not going to get any bigger than that. But by giving him a heavier weight, we progressively load the muscles a little bit more. And so then we start to get this adaptation occurring where the muscle grows in size. And so basically what happens is that we place stress or load on a muscle or tissue. It causes, I say damage, it causes what we call kind of micro trauma. So it does actually cause a little bit of damage to the muscle. We allow that muscle or tissue to rest and recover, and then it goes through an adaptation or growth period. So if you think about it yourself, after you do a heavier gym session or work like that, you may feel a little bit sore, but then that goes away. And over time, you do start to see these increases in strength. However, we do need to be mindful that too much load can sometimes result in injury. So it needs to be sort of managed quite carefully, and with progression is the key.
Kristin,
now we can,
Sorry, can I just ask with the overload principle, is there an example that you would consider to be within horse rehab? I'm trying to think from a weights perspective.
Yeah.
I'd love to hear like an example of what that would look like for a horse rehab.
Sure. And so I was about to kind of talk a little bit about that, but we can do, that's all right. Also, we can do things like about increasing speed of movement. So we could go, obviously at a walk, but then we increase speed. And so that can be a way that we're increasing load as well. We can increase frequency or duration as well. So we can increase the length of time that you work in a training session or duration. We can alter the type of exercise that you do. So say, for example, if we're looking at a dressage horse, by introducing lateral work and more collected work and things like that would be ways that you would start to overload. You can also decrease recovery time as well. So a few different things like that. And I'll give some more examples of things that we can do in horses as well. All right, so just going a little bit further on about kind of DOMS, and I'm sure that we've all experienced DOMS or that day after leg day. So essentially what it is exercise-related muscle pain. So usually it will develop after excessive or unaccustomed exercise, and particularly if that exercise has what we call an eccentric component. So an eccentric component, think about when you're doing, say, squats or walking downstairs or kind of that really low, slow braking almost type exercise. That's what we call with an eccentric component. So in a horse, again, probably think about your high level collection work would have a quite high eccentric component to it. Now, DOMS is thought to be caused by tiny, tiny little micro tears or little strains in the muscle, and this results in an inflammatory response. And it is thought that horses, like people, can suffer DOMS, and there has been some research that has looked at inflammatory markers in muscle and blood that has shown that. So more just to kind of think about how you feel after you've done heavy or unaccustomed exercise, particularly after you've had a break. Have a think that your horse can potentially feel that way as well. So you might want to think about, allowing for recovery days or making sure that if you have a horse that's come back into work or is going through a rehab program, that we don't want to do consecutive heavy days. All right, so let's look at some ways we can do strengthening exercises in horses and the research behind them. So one of the first things that we can look at, a really simple strengthening exercise, is using gradients. So there is evidence supporting the use of inclines to progressively increase muscle activity. So if we have a look at this horse here walking uphill, so what they've found is that kind of steep uphill gradients help develop power in the hindquarters. So we can see here that this horse is having to work quite hard, pushing through those hindquarters. We're seeing quite good muscle activation there. The other thing that can be really good with doing uphill work is that it changes the how much load is going through each of the limbs. So in a normal horse walking on flat ground, there's slightly more load going through the front limbs than there is in the hind limbs. So by placing a horse on an incline, we're taking some of those load off those front legs and putting a bit more load on the hind end. So for example, if we have a horse that has had a forelimb injury, this might be a good way to reduce some of that load while still doing some strengthening work behind. Conversely, if we have a horse that has a hind end issue, then this can be a good strengthening exercise, but it may be something that we would introduce a little bit later in the horse's program, since it is going to be loading up that back end a little bit more, if that makes sense. Then if we look at a downhill gradient, so what this has shown that the horse really relies on that eccentric muscle contraction, particularly of the forelimbs. And I just thought that this is quite a nice video to really show, just play that again, how much movement we're getting of that scapula there, that shoulder blade, and then how much muscle activation we're getting of those muscles there around the thoracic sling. So it can be actually we often think about doing uphill work, but downhill work can be a really good exercise as well. Has a lot of that eccentric work happening in it. Okay, the other thing that we can do is using weights and destabilization techniques. Now, Paulie said that we can't put horses in the gym, but we can in a way by using hind limb weights. So these weights are only 500 grams up to a kilo. It's been based on some research that was done by vets from the Michigan State University in the USA. And what we do is we attach the weights around the horse's pasterns here. And what the research has shown is that it increases flexion of all the joints from the stifle, which is here, all the way down, and it increases activation of the muscle around the hip there. Now, in our clients, we use these in horses in both walk and trot. We start in hand, and then you can progress to putting a rider on board. We keep the length of time with these short. So we don't have the horses in these for really long periods of time, usually kind of 5 minutes we would start with. We may progress it a little bit more than that, but we're not having the horses in these for really long periods of time. I'll also say using something like this, I don't recommend that you do unless it has been advised by your vet or rehab practitioner. We need to make sure that it's a suitable exercise for the horse. Okay, and then another thing that we can do is what we call a destabilization exercise. So this is Emma here. Sorry, I didn't turn the volume off for it. She's going to hate me for that. And what it does, I'll talk over the top. I don't know if you can see there. I know it's probably quite hard to see on the video. What she's doing is that she's lifted the horse's front leg off the ground, and then she's using her body weight, her shoulder, to push into the horse. And if you look here at his hindquarters, hopefully you can see that there's a bit of a rounding and a little bit of a increase. If you can look here, you can see that that side of his hindquarters is lifting a little. I'll play it one more time for you. I'm sorry, it wasn't the best video. I couldn't find a better one. There's been some research done on this as well, and what the researchers found is that it increased the muscle activity of what's called the biceps femoris, which is one of the big muscles of the hindquarters, by doing that. And it can be quite challenging. We see some horses that really struggle with this. We have, we take one leg off the ground, we push them back, and they really struggle to stabilize. So it can be quite a good exercise for horses that have some weakness around there. Okay, stretching. This is a really hard topic to condense down, so I'm going to give a very quick summary of it. But suffice to say, there's a lot I'm not going to talk about tonight because we'll just run out of time. So static stretching, everyone's probably pretty familiar with static stretching. So this here is an example of a static stretch. And basically it involves lengthening a muscle until the stretch sensation is felt, and then holding the muscle for a period of time. We then also have something called dynamic stretching. And obviously this would probably be an example of that, in that this woman's probably going to come down into that lunge position, stay there for a couple of seconds, stand up, and then swap legs over again. And I'll show you an example of a dynamic stretch in a horse. But basically what that involves is the performance of a controlled movement through range of motion. So you're not holding it for a period of time, you're moving in and out of it. So another example would be, say, standing on one leg and swinging it forwards and back. You've probably seen footballers or other athletes doing that as a warm-up. Now, what I will say about stretching is that, particularly in humans, there's lots of conflicting research about stretching. There's been, in probably recent years, some research that has shown that static stretching can have a negative effect on performance for strength and power activities. I'll talk about that a little bit more. And there was a big shift away from doing static stretching as part of a warm-up, and a real big move towards dynamic stretching. I'm going to talk a little bit more about that in a minute and what some of the latest research has said about it. But if you talk to many health practitioners, there'll be a lot of people who are pro-stretching and a lot of people who aren't so pro-stretching. We do often talk about stretching as something to reduce injury risk and things like that. There isn't actually a lot of evidence to suggest that that is the case, unless it is in someone or an animal. I'll say in people because all the research is in people, unless it is in someone that is showing particularly restricted range of motion or reduced flexibility. So in a person with normal range of motion or normal flexibility, there isn't actually good solid research that suggests that stretching will minimize your risk of injury. Alrighty, so what is an example of a static stretch in a horse? Now, a static stretch in a horse is kind of difficult because the definition of static stretch is taking it to the point until a stretch sensation is felt and then holding it. And obviously a horse can't tell us that. They do often tell us in their own way by saying, they'll pull back or not feeling very comfortable with it. So we can listen to them a little bit as to how far we take the stretch. So we may also call it a passive stretch, but often these are those ones that we look at where usually it's going to be a limb, where the practitioner or the person is taking the horse through a range of motion and they're going to hold it, usually for a period of time. An example of a more dynamic mobility may be something like what a lot of us know as a carrot stretch. And in this stretch here, or this exercise here, we're not actually just holding it in one position. You can see we're moving the horse up and down. So we're going through range of motion through that lower part of the neck as we do that. You'll notice when we perform any of our carrot stretches, we don't actually perform them dynamically. They are actually called dynamic mobilization exercises when kind of in the research, and they have been designed to be performed in that more dynamic fashion where you're not holding them for a period of time. Another example may be something like down in this corner here. Oh, sorry, I haven't turned that one off either. Finish at that one. But what we're doing here is you can see we're circling the horse's leg. So it's going to mainly affect the hip joint, this one. We're just going through a bit of range of motion with that. So it's quite dynamic. We're not holding it in one period of time for any length of time. Alrighty. Oops, so I'll go back to this one again. And so this is a really important thing to make. So yeah, most of us call these carrot stretches or baited stretches. As I said, we call them dynamic mobilization exercises or DMEs. And I think the really important thing to take away that this isn't just a stretch or a mobility exercise. So there has been about 3 research studies that have looked at the effect of these particular exercises. And what they found is that performing these exercises in that dynamic fashion, so you take the horse around, you come back up. You go around, you come back up, you repeat that 5 times, usually is what they did in the research. They found that doing that 3 to 5 times per week led to an increase in the size of the small muscles that help support the spine. So they're called multifidus muscles. They run right along the length of the spine, and their role is to improve stability of the spine. So often you will be prescribed these exercises to help improve spine strength and stability, not just mobility. And there's quite convincing research that they do that quite well. All right, so just going back to what I said before about dosage and stretching based on the research. So again, this research was performed in humans, and this is based on a systematic review. So a systematic review looks at all the research that has been conducted on a particular area and goes through it and evaluates it. So it's probably the highest level of research that we can have. And this was a really recent one. So it found that when they looked at studies in which people performed static stretching just before a strength and power activity, so for example, before they did sprinting or before they did jumping, there was lots of research papers that were coming out saying that static stretching had a negative effect. What this paper, when it went through all those research studies, found is that performing static stretching for a short period, so less than 60 seconds, doesn't actually have a negative effect on strength and power if it's performed directly before the activity. So I'm not talking about just doing stretching in general, but if you do stretching just before you perform the activity, so jumping or running or whatever it may be. However, they found that static stretching for prolonged periods, so greater than 60 seconds, did have a negative effect on strength and power. Okay, we don't exactly know why. And again, you can go down a rabbit hole of reading hundreds and hundreds of papers about this. There is actually a lot of research papers on stretching, and nothing is really conclusive about it. It can be related to the effect that it has on the nervous system or an effect on the muscle and tendon directly. And that's quite likely a combination of the two. But the main message I kind of wanted to take away for tonight is to think about stretching in terms of, I think a lot of people just do stretching because they think that they should, or they see other people stretching their horses and think that they should do it as well. I think my main takeaways are, I don't think stretching needs to be done routinely on everybody, or on any horse. I think in cases where your horse is showing restricted range of motion or reduced flexibility, then absolutely stretching can be really important. I think we also need to consider that in high performance horses, static stretching should be applied with caution directly before competition or activity because of these potential negative effects. And we know that really minor performance differences can have a major impact on success. So certainly you may still want to do your stretching exercises as part of your horse's training or rehab, but we may want to consider just not doing them directly before competition, or looking at these times based on the research. Okay, but
can I just ask you a quick question?
Sure.
What about after exercise? So, as part of cooling down, or, when you've gone back to the tie up and, done a shoulder stretch or something like that, is there any research on stretching after the body is warmed up and exercised?
Again, it depends what you're looking to do. So if you're looking to increase range of motion, then absolutely it can. And obviously, I've got this point here that it has a positive effect on increasing range of motion.
Mm-hmm.
In terms of recovery, no, there's no research that suggests that stretching is going to reduce muscle soreness or improve recovery.
Wow. That's really interesting.
Despite what we think, there is no conclusive evidence that says yes, it does. So I think, though, a lot of people, though, it makes them feel better or they like it, and then absolutely you should do it if it feels good. But you don't need to do it.
Yeah, interesting.
I don't know, and there may be lots of people being horrified at what I'm saying now and will disagree, and I'm more than happy to talk about that and have a discussion about it. But as the current literature stands, there isn't anything that definitively says yes, it does.
Super. Thanks for that.
But the other interesting point that I'll just make too about saying that, yes, it has been found to have an effect on increasing joint range of motion. We often think that's because we're lengthening muscle or increasing the length of the muscle. What is thought largely to happen is that, again, there's no proof that happens. What is likely happening is that we have an increased tolerance to the stretch as opposed to physical strength changes in the tissue structure. So there's been several studies that have suggested that, it's related to an increased stretch tolerance. And so this is likely due to a reduction in the perception of discomfort with the stretch. So basically, the more you do it, the more comfortable you get with it, the better able that you are to do it. I will say, though, that more research needs to be done to fully understand that. That's kind of just some thoughts at the moment. All right, let's leave stretching behind and talk a little bit about cardiovascular training. So, that's pretty simply just your fitness type thing. So our aim is to increase heart rate without aggravating the injury. So examples of that may be things like swimming or water walker or treadmill, hand walking, lunging or long lining, or restricted riding. We won't talk too much about those sort of things, but it's just important to consider them. All right, but we'll talk a little bit more about proprioceptive training. So proprioception is the perception or awareness of the position and movement of the body. So just kind of that awareness of where the body is in space. And when we do proprioceptive training, the aim is to increase speed and efficiency of neuromuscular control to prevent re-injury. So soft tissue injuries are often accompanied by these proprioceptive impairments, which often persist after the acute injury phase. So say, for example, if you have ever sprained an ankle before, that's an injury in humans that quite commonly has proprioceptive deficits afterwards. So it may be that when you say walk on an uneven surface, you're a little bit more likely, you feel a little bit more unstable on that ankle, or sometimes you'll often be more likely to roll it again because you just don't really, your body has lost some of that awareness of where it's placing itself. So ways that we can address that in the horse are to look at either influencing balance or to changing the neurosensory input that we put into the body to the brain as well. So it has an effect on the nervous system. So some examples of that, and I'm going to go through these a little bit more in detail in a moment, but these are things like using the Equiband system or tape, something called tactile stimulation as well, stability pads as well, or surefoot pads, or there's lots of different things that people use, but that puts sort of a sensory input to the horse to give them some awareness of where their feet are. We can also use progressive balance exercises. So that might be weight shifts like the exercise that I showed you before, picking up opposite or diagonal limbs, walking on different surfaces and poles, things like that. And so this stuff can often be utilized very effectively in the horse because of how densely innervated their skin is with sensory nerves. So we know that horses can feel, you know, a fly landing on them. So they're often very receptive to this kind of sensory input. So what might be an example of a horse with poor proprioception? So things like tripping or stumbling. One of those horses that just can't seem to walk over poles without hitting them. So they just don't really seem to have that awareness of where to put their feet. Now, if you have a horse that is falling and things like that, that may be something that's a lot more serious than just having, you know, a poor proprioceptive horse. And so that should always be investigated by your vet. All right, so poles. So there was some research conducted by those same researchers who did the weight study, actually, that looked at what effect poles have on horses. And what they found is that the horse obviously lifts its leg more, like we see in this video here. What's that one? But why that occurs is that the horse is flexing all of the joints in its limbs more. It's not actually lifting its body any higher. So all that kind of limb, that flexion that we see is just because it's flexing these joints more. The really good thing about using poles is that there's no habituation. So the horse has to pick its feet up every time when they walk over the poles. So a little bit different to, say, like the weights. The horses do get a little bit used to them after a while. And also another device that I'll show you next. So we can do things, you know, very simply, poles in riding. This is a nice little exercise that we often use as well. And it's a good setup because it's quite versatile. So we can walk and you can ride the horse as well through the poles, and it has to think about changing direction as it goes through. Then you can walk over it in different formations and things as well. So it can just be quite a good setup. This horse is an example of a horse that has terrible proprioception. And I think that he hits poles every single time he walks over them, despite all the training we've been doing with him. I don't think he's going to make a jumper. Okay, so the other thing I mentioned was the Equiband. So for those of you who haven't heard of the Equiband, it was designed by some physiotherapists in the US, and they actually designed it for horses following colic surgery initially, but have kind of found other benefits for it in rehab and also training. So you've got a saddle cloth here, and then you've got my mouth, 2 resistance bands, one that goes underneath the abdomen, and then another one here that goes around the hindquarters. So there has been some research that has looked at these and has found that it can improve the stability of the spine. So here's just an example of a horse. This horse is actually recovering from kissing spine surgery. And so we were lunging him with the Equiband on, and he went really beautifully in it. The nice thing about the Equiband, as opposed to some other training aids, is that you can ride in it as well. So, you know, you can use things like the Pessoa and get a similar effect. The difference between this, say, and a Pessoa is that there isn't any connection to the front end. With that, you're just having the abdominal band and the hindquarter band, and you can ride with it as well. So it sort of can be a nice tool to use as you progress through your rehab. Okay, and then the other thing that I talked about before is something called tactile bracelets. So this is based on research, again, from Michigan State University. What they are leather, or you can use webbing or anything like that, straps that has very, very light chain hanging off it. Now, a lot of people often get quite upset when they see this. I assure you that these are very, very light. These weigh about 50 grams, okay? The idea of the chain is that it provides an increased stimulus so the horse can feel it moving. Now, you'll have some horses that are super sensitive that we don't put this on. It's certainly not something that we use on every horse. And some horses will get that effect just by having boots on, or a bell boot or something like that can be sufficient. In a horse that may have a neurological deficit, or needs a stronger stimulus, these can work quite well. What basically happens with it is that the brain perceives this sensation as an obstacle and encourages leg flexion. So a bit like saying a horse walking over a pole, the feeling of the chains moving on the foot, and you don't have to use steel, you could use plastic, whatever you want. It just needs to be something that's going to create some movement on the leg. So the horse feels that the brain thinks, oh, there's something there, I better pick my foot up to clear it. So it's a bit like walking over a pole. The benefit of this over using a pole, because a lot of people say, why can't you just walk over poles, is that the stimulus is there constantly. So a horse is only going to lift its leg when the pole is there, and then it may go back to not flexing the leg as much. This is just a constant stimulus to help improve that. Now, an example of when we would use this may be for example, a horse that's toe dragging. And that's probably one example of a time that we would use it a lot. The horse does habituate to these very quickly. So we only use that for short sessions. And I'll show you this video to show you what I mean. So you can see as the horse walks off, it picks its legs up more, kind of similar to, say, when float boots are in some horses. But we can see as he keeps walking, that movement becomes less exaggerated. So the research found that after around 200 meters, the horses stopped picking their legs up quite as much. So again, we only use these for pretty short sessions of time. Sometimes they may be used, we've used them sometimes with horses walking over poles and they keep hitting the poles. We put these on as well, and it just gives a little stronger stimulus just to try and get some more flexion happening through here. They should only, they're not a training tool. So certainly we don't recommend that you use these for horses where you think, great, I want to try and just get some more flexion happening for them. They are a rehab tool that are designed to be used for specific conditions. So if your horse already has a normal range of motion in the limbs, you shouldn't be using these. It's just in cases where we have a problem that we might be trying to address and we need a slightly stronger stimulus. Okay, so how do we progress a rehab plan? So couple of parameters that you should look at. So a really easy one is just the type of activity that you do. So obviously in the early stages, we want to perform activities that don't directly stress the injured area, but may still result in some whole body mobilization or strengthening. And then in the later stages, we want to really look at activities that are going to specifically load that injured area to help strengthen it, test its integrity and prepare it for functional activity. So that may be things like, gradients or more sport specific training. That may be grids if you've got a show jumper or things like that. So first thing we can look at is, how can I change the type of activity to start to get to be a little bit more back to the horse's job? We can also look at duration as well. And so we might start off working 10 minutes and build up to 60 minutes, which is often the main parameter that people change in rehab programs, but it's certainly not the only thing that we can be doing. And often what you're better off doing is keeping at a particular level of time, but increasing the intensity of the exercise session or the training session. So you might keep the horse working at 20 minutes, for example, but you increase the intensity. So that may mean, for example, you do more fast work. So rather than just walking for 20 minutes, you start to introduce some trot work in it as well. Or we might start to introduce some more challenging work. So we introduce circles or things like that as well. So just increasing the duration of the activity isn't the only way that we can progress the rehab. So frequency as well. So the really important part of rehab is allowing for recovery. So as I said before, we looked at that overload principle. We place stress on a muscle, but we need to allow time for it to recover, to adapt and get stronger. So like we talked about before, if you're doing a really high intensity session, you might want to allow longer rest periods between it. So if any of you go to the gym and do strength training in the gym, you know that you probably only need to do heavy strength training sessions about 3 times per week. So if you're working your horse or doing those heavier intensity sessions, you might look at doing, okay, I do those 3 times a week. And then those other 2 or 3 days, we just go out for a hack or a walk, or we do something light as well. So I think that's really important to remember, is that we've got to allow time for our horses to rest and recover as well. I touched on this just briefly before, so increasing the intensity of a session as well, and then the complexity of it as well. So we can start to make the exercises that we give the horse a little bit more complex. So in a dressage horse, that might mean making the lateral work that we do a little bit more challenging. A jumping horse, we can increase height of the jumps. We can, put in some combinations and things like that to make it a bit more challenging. Okay, let me introduce you to Mr. P. So some of you have been on Horse Rehab, but you may have seen him already in some of our videos. So he is a 5, although I think it's actually his birthday this week coming up, so he will be 6. He is a thoroughbred gelding that came off the track in December last year after sustaining a pretty severe injury to his right forelimb superficial digital flexor tendon. He was a pretty successful racehorse. He was in the city, so he wasn't a slouch. He won a bit of money. And he came to Equimotion as a rehab case study in late January 2021. So Emma and I actually took him on as our project horse, and we decided to see if we could implement a little bit more of a progressive rehab program for tendons and see if we could get him back a little bit faster than often is expected with a horse with an injury like this. Our goal for him was to have him walk, trot and canter under saddle by the end of this year. All right, so here are his ultrasound images when we got him. So he did have an ultrasound just after sustaining the injury, at which time the vet thought that he had completely ruptured the tendon. We don't have access to those images, unfortunately, but this is the first one that we got at kind of 3 months post-injury. The vet at that time kind of concluded that he probably hadn't completely ruptured the tendon, because we could still see some improvements in there, or we could still see some attachments in the tendon. For some reason my mouse, oh there we go, we can see my mouse now. Okay, so these ones here are the left tendon and these ones here are the right. Now already you can see the first thing is that this tendon is hugely bigger than this one as well. So that's pretty common to have that thickening through the tendon. But up the top here is the superficial digital flexor tendon, and you can see compared to this side, we've got a whopping big black hole here in the middle of the tendon. So that's a lesion in there. You can also see, if we come down here at this cross-sectional view, is that the fibers on this left side, you can see that kind of linear horizontal pattern. When we come over this side, it starts to become kind of all mottled and blurred in here. So this is where the fibers are all, there's a disruption to the pattern there of the fibers. And it was about a 15 to 20 centimetre tear in the tendon, so it was a fairly decent size. All right, so another way that we measured how he was going was using gait analysis. So for those of you who haven't seen what we do with that before, we use something called inertial motion units, or IMUs. And these are these little sensors here that we place on the horse. They measure limb symmetry, so how evenly he is loading and pushing off on each leg. And these sensors here also measure three-dimensional spine movement as well. I won't talk too much about those because that's not particularly relevant to his case, but just something to be aware of, that that's what we can measure. All right, so this is what the output looks like of the limb symmetry. Basically, let's look at these ones here. Ignore those ones in the middle because they're probably not as easy to see. But what we're looking here is the forelimb. This is when the right forelimb, and this is looking at the left forelimb. Essentially, a horse that is moving symmetrically will have this black line as straight as possible. What the sensors do is, so if we look at, this one's looking at the sensors that are sitting on the pole and the wither. When the horse's foot is in contact with the ground, the head and the pole drop. And then as a horse pushes off and is in that mid swing, when the leg is off the ground, the pole and the withers rise up. So what the sensors measure is when each foot is in contact with the ground, what height is the sensor and what's the difference between left and right, if that makes sense. So if you think about when a horse is quite lame, we see that head nod. It's not usually what happens is when the lame leg is in contact with the ground, the horse doesn't drop its head quite as much. And that's usually because it's trying to offload that leg. So we see that lift of the head. What also happens though, even though we see that head nod, when the horse is in or pushes off the ground, the lame leg, they usually, sometimes, not always, and it depends, this can help us tell when the lameness is occurring, but they may not push off quite as much either. So that can be suggestive of it's painful, so they don't want to put much force and push off through the leg, but there may also be some strength deficits there. So what this shows us here is that right forelimb, he isn't loading it as much and he's not pushing off as much. So ideally, again, these lines should look nice and even. So we can see here that when the right foot's in contact with the ground, it's quite different to when the left foot's in contact with the ground. And we actually have some objective measures. So basically what this is showing is that when the right foot is in contact with the ground, the pole is 22 millimeters higher than when the left foot's in contact with the ground. So he's not dropping his head as much. So we're kind of seeing that up movement. And then when he's pushing off, his wither and pole are 15 millimeters lower than when the left foot pushes off. So he's not pushing off as much on that leg. But what this is showing us is that that 22 is obviously higher than 15. So he's taking, it's kind of worse in that support phase, if that makes sense. I hope it makes sense. I know it's quite complex. This here is looking at his hind end. And we can see here that already that graph looks a little bit more even than this one. This line's a little bit straighter. He's getting a little bit of a right hind limb push asymmetry. So he just wasn't pushing off as well on the right as he was on the left, but it's pretty marginal. So the research kind of says that anything greater than 5 millimeters in the forelimb and 8 millimeters in the hind limb is considered to be abnormal. So if you're getting measures around 3 millimeters, 5 millimeters, that's considered to be within a normal range. I hope that makes sense. Sorry, I realized that's quite a lot of information. All right, and then we also did our physio assessment. So what kind of things did we look at for that? So we just generally did some tendon feel and his response on palpation. And Emma and I both did that, and we concluded pretty evenly that we agreed on what we were finding. So there was no pain response on palpation of the tendon. He wasn't pulling the leg away. He wasn't, there was no ease back, biting, any kind of that type of behavior. There was certainly thickening of the tendon, and I'll show you a photo of what it looked like in a moment. He had full range of that fetlock though, so we could move that, and it was equal to the left side. What we found here with the stability pads, and hopefully you can see that, is that he was putting more weight through the left foot than the right foot. Can you see that there's more of an indent there on the right? And I realize that this is a photo and a moment in time, but we did this quite consistently. We did this a number of times, and he was loading that quite consistently. So that was just a way for us to visually see how he was loading. And we noticed that his grazing habit, he was always standing with his left forelimb forward and kind of wanting to take the load off that right one. Then we used a DME to also look at kind of what he was doing in terms of loading. And I will apologise for him now. He loves licorice and gets his manhood out every time we do this. So what we found, if you look quite closely at his right forelimb, every time, sorry, I thought I muted all these videos. You can see that as his nose gets down towards his fetlock, he starts to bend his knee. We go down again. So we got to a certain point, he started to bend it. And so it was quite sort of consistent. I think he did it here.
Right. And I'm trying to take his range just to the point where he keeps that leg nice and straight.
We come back a little bit.
Nice and low.
Here. and he would bend his knee if we sort of started to take it too far. So that was just a way for us to be able to measure how he started to feel more comfortable as we could take him further back. Could he keep that right knee straight? All right, so how do we manage an acute tendon injury? So the first phase is we need to manage pain. So we want to avoid activities that place the compressive load on the tendon. So usually this is any activity that would involve stretching the affected muscle or direct tendon compression. We want to avoid fast speeds or jumping or anything like that that's going to put a lot of load through the tendon. And so sometimes stabling or confinement to a small yard may be appropriate for some horses if we suspect they're going to go out in the paddock and be a bit crazy. So what did we do in month 1? So we call it month 1. It was really 3 months post-injury, or the 3rd month of his injury. He had spent the first 2 months pretty much in a stable doing nothing. If we had had him earlier, we would have started this process a bit sooner. We actually wouldn't have just kept him in a box and not done anything. But our focus in that time was to start mobilizing and get him moving a little bit more. So we didn't have him in a stable. We just had him in a yard, and we let him out each day to graze in a kind of supervised small space. We just did some hand walking daily. We started doing some DMEs with him, like you just saw. We found that his proprioception, like I said before, was really, really terrible. So we thought that's something that we wanted to address. So we started doing some pole work with him, and we did some bracelets as well. So the first month, you just want to kind of settle that pain and get the horse moving again. Then phase 2 is we want to increase strength. Now, in humans, it is thought that just repetitive loading, such as walking or running, is unlikely to stimulate significant adaptive changes in tendon. And how we would treat a tendon in a human is that we load it pretty heavily. And I know that probably goes against everything that we think that we should do, but we do something called heavy, slow resistance. And I'll talk about that a little bit more on the next slide, but basically we put a lot more stress on a load on a tendon in a human to get it to recover, because we know that increases more, that leads to more adaptive change. And so we were starting to question, are our typical in-hand walking programs for horses going to be enough to get the tendon changes that we need? Because at the moment, the rate of re-injury in tendons is super high in horses. It's about 50%. And, in humans, the rate is, say, around 10% for a tendon rupture. So what are we doing better in humans that we can try and do in horses as well? So something that we wanted to look at is this heavy, slow resistance training. And basically what that is placing heavy loads on a tendon with fewer repetitions. So, for example, in a human, we would get you in the gym, load you up with some weight, and get you to perform an exercise that you can only do 7 to 8 times before that's too much for you to be able to lift anymore. So you may do that for 3 or 4 sets, but we keep the weight pretty heavy. So say, for example, you're going to be having a 20 kilo weight while you do some squats, potentially even heavier for some people, as opposed to just doing body weight squats for 50 repetitions or 100 repetitions. You're going to lift that heavier weight, but for only 7 to 8 repetitions. Now, the main point to take away from this is this word slow. So we are not doing these exercises fast, because how tendons work, and again, this is an area that's sort of really in depth and probably out the scope of what I'll talk about tonight, but how tendons work is that they store elastic energy. So we place sort of a load or a tension on a tendon, and then it stores elastic energy, and then it releases that energy and produces movement. Now, tendon is what attaches muscle to bone. So it kind of is that force storage from the muscle that transmits onto the bone to cause movement. So our tendons are really strongly involved in running or jumping and all of those sorts of things. But what we can do in in doing strength training or doing adaptive tendon changing with them is to apply these heavy, slow loads. So we're not actually putting the tendon under high loads of stress in terms of what it's designed to do. So I don't know if I've explained that very well, but usually a high load or stress on a tendon will be, say, jumping or running or things like that. That is a high stress activity on a tendon. Whereas, say, doing as a human, doing a calf raise really, really slowly with heavy weights isn't as putting as much load on the tendon as, say, as hopping on that leg. Hopefully that kind of makes a little bit more sense. So how can we do heavy, slow resistance training in horses? One of the biggest things that we did is we put him on sand pretty quickly. And again, I know that probably goes against everything that we often think about doing with soft tissue injuries. But what research has found is that, yes, there is more load on a tendon on a soft surface compared to a hard surface. However, if we're keeping the speed slow, so we're only walking and we're keeping the duration short, we're actually doing the same kind of heavy, slow resistance training that we would do in a human. So if we think about, we're doing almost like a weight, we're putting more load on the tendon. So we've gone from just doing a body weight squat to a squat with 20 kilos. And it's not comparable, but just to try and give you a visual in your mind. But rather than work that horse for 60 minutes or 40 minutes on the sand surface, we might do 10 minutes. And so we are putting more load on the tendon, but we're keeping the duration short and the intensity a little bit lower than, say, we just did competitive, walking for long periods of, go and walk 60 minutes on a hard surface. So hopefully that kind of makes sense as to a way that we can start to load that tendon a little bit more progressively. We can also do things like weighting the limbs, like we talked about before. We can progress from straight lines to circles because we know that puts a little bit more load on the tendon as well. We can introduce gradients and bank surfaces. So like we talked about before, putting a horse on an incline or a decline is going to change the amount of load going through each limb. So if we're trying to load up the forelimbs a little bit more, for example, we may get the horse to do some downhill work and vice versa, or we can introduce rider weight. But we must, if we're doing it in this kind of early stages, that heavy, slow resistance, we must keep the speed slow and the duration short. I hope that makes sense. Okay, so what did we do in month 2? So this is when we really ramped up the strength work. And again, this was 4 months post-injury, but only his 2nd month of rehab. And you can see we did quite a lot. We were doing gait analysis with him every 2 weeks. So we introduced this all based on our assessments. So I would suggest that you don't just look at this and go, oh, great, I've got a horse with a tendon injury, I can just throw all these things at it, in the 2nd month of injury. This was all based on us doing our assessments every couple of weeks and basing it off that. So again, I'll always say you should be working very closely with a rehab practitioner to help you in how you should progress those exercises. But we did start trotting him by the end of that month, which our vet was kind of a little bit freaked out about, but we were pretty confident that he was managing with it pretty well. Okay, so how did we measure his progress? So I think one of the trickiest things sometimes is owners to go, how do I know if my horse is getting better? And now obviously we're really fortunate to have things like gait analysis and that we can use, but there's lots of little tools that you can do at home yourself. And I think one of the best things that you can do is take photos. Take photos every 2 weeks. Get your horse in the same position each time and see that as a mark of improvement. So here, and I apologize if it's hard to see, but looking at the weight through the stability pads, we were starting to see that he was weighting a little bit more evenly at this time compared to this one when he was really more weight down through there. This was the tendon, I think, a week after we got him. You can see looking pretty thickened and swollen and yuck there. And that was a couple of months later. So starting to look a little bit more like a normal leg. And then looking at muscle symmetry as well. So just starting to see how much he was filling out through there and looking much better through that hindquarters. Another really good way that you can listen to how your horse is loading its legs is to walk it on a hard surface and record it. It will depend on how good your ear is. You might want to close your eyes sometimes and really listen to it. But get your horse walking on a hard surface, and obviously if it has shoes, if it does, if it's barefoot, this is going to be a bit harder to do. But do those footfalls sound even? Is the timing even as well? And that can be a nice little tool that you can use as a comparison to see how your horse is going. Okay, so we started to progress a little bit more by doing some more challenging exercises. One of the things we did was lunging across a hill. And so this can be a really super exercise to do that's working on lots of different things and increasing that complexity that we talked about before. So we'd get him to walk down the hill, trot down the bottom, get him to trot up, and then he'd walk across the top and then walk back down as well. Now you can make this more challenging by, you can see that this isn't a very steep slope. You could start to make that a little bit, increase the steepness of that slope as well. And that can be a good exercise to do. We started to do some long lining, ridden work and things like that as well as we progressed in. And so then when we got to June, this is what our Equigate looked at. And so if you can remember back to that first one looked at, how much straighter these two black lines are looking and how low these numbers are. So we're getting 4 and 2, 5 and 6 there. I would be pretty happy if I came and did that assessment on a normal horse in work. If I got measures like that, I'd be pretty happy that your horse was sound. So yeah, we're pretty happy with that, kind of 6 months post-injury. This is his ultrasound. So we can still see thickening through there, and look, that tendon's probably always going to be a little bit thicker now, but we don't have that whopping big black hole in there anymore. There's still a little bit of disorganization there in the fibers, so we still have a little way to go, but we're starting to see some of those fibers realign. You can start to see some lines happening in there again. It's not just a big blurry white mess anymore. All right, so after we had that last scan, we started doing some canter on the lunge. We started introducing some laterals because remember, he's an off the track thoroughbred as well. So big part of our work with him is training just as much as rehab as well. And this month, our plan is to start cantering him under saddle as well. And look, and we have had occasional setbacks with him, but interestingly, we often found that that was related to episodes of decreased work. So when he did less, he actually would go backwards a little bit. So we found that keeping his work consistent was best for him. And just a few considerations, particularly about tendons, but I think about many injuries in general. Tissue response to load takes time. We need to allow adequate rest days between strength sessions, as I said before. Significant changes in muscle strength take 6 to 8 weeks, and tendons change slowly, so it may take 3 to 4 months to respond to a loading program. And I think that's the biggest thing. Often people, and I've even seen other practitioners like, oh, I've seen this horse a couple of times now and he's not getting better, or why is it 2 weeks and my horse is not getting better? It takes time. So I think you need to be patient. You need to accept that sometimes things aren't always going to go to plan, and you might have weeks where you go a little bit backwards, and that's okay. I think just keep working with your practitioner and have a plan, and a plan is always going to be fluid. Some weeks you'll have to change things a little bit, but I think my biggest message is there's no quick fix in it. And as I said a couple of times, most important, please only apply anything that we've discussed tonight on the advice of your vet or rehab practitioner, particularly if your horse has got an injury. You should really be getting professional advice on which of these things are appropriate. All right, so that's me done. Our website is there if you want to take a look at what we do, and my email address if you have any questions, but happy to answer any questions now.
And that was fabulous. I love listening to what you do, and especially having seen the changes in Mr. P especially. You know, we've started saddle fitting him, and that's one of the things that you know, when we're talking about, you listed all the practitioners that you use, you know, we're always talking about getting a circle of care, because for us with a horse that's had a tendon injury or it's had any kind of significant injury where it's in a rehab program, by the time people get to putting it under saddle again, they need to make sure they're getting the saddle checked at the beginning, because there's a degree of asymmetry that will have happened in the horse's body from a saddle fit perspective that we need to make sure that we address. Otherwise, by the time you start riding him, if we haven't addressed how we're going to saddle fit for that asymmetry, he'll get sore, and then he's going to go backwards. So, you know, I just love knowing that you're really encouraging people to take that holistic, you know, viewpoint of rehab in the horses, so that we can actually progress them. And I know you've worked, you know, really closely with Erin the farrier and, you know, nutritionists as well. So I think that's fabulous.
Actually, that was the point I didn't make, but I think, weight management, particularly in tendon injuries, but in many other injuries, is so important as well. And for us, looking at, we didn't want him to get too heavy, so keeping his weight at a particular level was really important. And so that's where working with a nutritionist was really key in keeping that under control.
Yeah, absolutely. We've got a question from Leslie asking whether you can do video assessments.
Mm-hmm. Yeah, and absolutely. So we're based in Sydney, and we travel to Central Coast and Southern Highlands, but we do work with people all over Australia doing video consultations. So yeah, absolutely. If you want to shoot me an email, Leslie, and we can talk about how we can do that with you.
And certainly at the moment anyway, half of us in lockdown, we're all moving to as much video work and photo work. So if people have got questions, I think there's a couple coming through now. That was Leslie. If you've got any questions for Kristin, please, you know, feel free to jump on in and ask some now, because we've been going for a while. It's 9:15. We can never seem to keep these to time. I guess there was so much in there for me as to how people can start to think a little bit outside the box of traditional rehab, in just hoping that the horse is going to get well, and actually setting a structure. And even I know with the interviews that we've done with you for Horse Pro Hub, you know, it was a bit of an eye-opener for me to learn that really we should be keeping our horses in walk for 6 weeks before we progress after that, and starting to, you know, think about going back to basic principles of actually structuring it, actually measuring it properly, so that you know that you're hitting those targets as your horse is, you know, coming back into work and rehabbing.
Yep, absolutely.
Now we've got a couple coming in here. Hang on a second. All right. I'd love to know more about the carrot stretches with movement. So that's the dynamic DMEs, dynamic mobilization exercises, non-static, apologies, I've forgotten the name. Is there a video tutorial to learn the correct technique?
Oh, good question. That could be something that we could look at.
You could, and I must say that we do actually have Nicola on Horse Pro Hub. We also work with Dr. Raquel Butler, who is equine vet, who's also a biomechanics vet. She has been recording both dynamic and static stretching exercises for people as well. So there are some resources out there, but definitely I think Kristin and Emma can get on to doing some recording on those as well. Let me see. Oh, we've got some more going here. We've got all right, from Stephanie. She says that was really interesting. Thank you. Do you find horses living out 24/7 with terrain helps as horses are moving more in the ways that you describe?
Yeah, look, I think it's always preferable to kind of try and keep a horse in a more natural environment and keep them moving. Obviously, they're a grazing animal and that's what they're designed to do. They're not designed to stand in one position all day. I think probably in terms of different terrains and even I guess the 24/7 will depend on a little bit on the horse. And from a rehab point of view, if we're talking specifically about rehab, I think you'll really need to look at it on a case-by-case basis. So for example, with that particular horse with Mr. P, we wanted to keep him in a pretty flat paddock to start with because, with a quite severe tendon injury in the early stages, being on a lot of those different terrains may have been too much load over a prolonged period of time. So we wanted to avoid that. But certainly you may have some cases where that's more appropriate. So I think it will probably depend a little bit on the horse and their condition. I mean, my preference obviously is always to try and keep horses moving more than keeping them still, but it probably needs to be a little bit of a case-by-case basis, I think.
We've got a question from Emma as well. She said she's obviously been watching what you've been posting on Facebook. You posted today on Facebook about how the structure of fascia cannot be released or changed. Could you please explain this a little bit further? There's a lot of focus at the moment on fascia and releasing fascia, in particular fascia blockages or being stuck, and she'd love to know more about neuromodulation effect versus fascia release, please. Wow, that's a big one, Emma.
Well, and obviously we talked a little bit about it in the post, and if you can get your head around it, I encourage you to read the study that we referenced in that is a good place to start, and then you'll probably, you find more papers to read off the back of that. But yeah, basically we'll hear a lot of people talk about, fascial release and that we can change fascia. But if we look at that research in particular, and there's been other studies that have looked at it as well, is that it takes almost 1,000 pounds, or I think it's worth about 450 kilos of force being applied to the fascia in a human to create only 1% change in the deformation of that fascia. So essentially what we've found is that there is, and they're applying this obviously in cadavers, so they're not putting that amount of force on living tissue. So, there may be differences found in living tissue, but even in humans, they've found that, we can't actually affect a lot of change on the fascia itself. And even talking about that stretching, as well, we used to think, we were lengthening muscles when we stretched and things like that. With fascia, what they've found is that you can create a slight change in the, I guess, in the length of a fascia short term after placing it on stretch, but it goes back pretty quickly as well. So essentially what the suggestion is that when we do massage, when we do stretching or anything like that, we're not actually changing the structure of the muscle or the fascia itself. We are changing the sensation of what we feel, is probably the best way to describe it. So neuromodulation basically refers to putting a sensory input, or it changes the way that the brain is perceiving either the perception of a stretch, discomfort, or pain, basically. So we know that when you go and have a massage, it feels good. We know that often just the sensation of touch, you feels good. When we're hurt or sad or anything like that, someone giving us some affection, and often that is in the form of touch, makes us feel better. And what the theory behind that is that sensory input has a positive effect on the brain. In terms of, what we call release or massage, what it's actually doing is usually causing a relaxation response in the muscle, which is from that sensory input. So it's kind of almost like a feel-good type mechanism on the brain that then has a positive effect on the body. So, and that's the case for a lot of the manual therapies that we do when we're doing, and I may have a lot of people want to argue this, but this is based on, you know, a lot of the science out there. I've been a physio for a really long time. Is that what we're doing is we're not actually changing, we're not changing the structure of anything. We're changing that perception. So having a massage, dry needling as well, massage guns, a lot of those things like that are just having a positive, what we call, neuromodulation. So it's just affecting that neuro input to the brain that then has a positive effect from the body. If that makes sense. It's a really hard question to answer in a short period of time. But certainly read that study if you want to learn a little bit more about the fascia in particular.
And there's more study going into this at the moment, Kristin?
Yeah. And I think like everything, there's always more research going into it. We don't 100% understand the whole concept of neuromodulation. And that's even changed a lot from the time I went to university. So when I was at uni 20 years ago, we were taught that we were changing things. But there is increasing research over the years, and even on looking at things like joint manipulations and things like that as well. We're not actually changing the structure of joints or muscle or soft tissue to the extent that we thought we were.
Interesting. So we've got a question from Patrina. She has a thoroughbred eventer who sustained a soft tissue injury it's an SDFT injury at the end of September last year, and she was locked up for quite a while and gradually given more pasture time. The tendon measured thicker at the 6-month scan than at the 3-month scan, and I was told to discourage running around and just wait until 12 months. Even before your presentation tonight, I felt like I should be starting to load the tendon to encourage the fiber pattern to improve. Do you think I've missed the boat in being able to influence this?
I don't think so. I think you've probably still got time to make a change, because you need to remember that tendon is a living tissue. And so it's not like a car part or something that's going to break down and can't ever change. Tissue will always adapt to the loads and stresses that we put on it. And so it doesn't matter kind of the amount of time, there is still capacity in that tendon to change, and there always will be capacity for that tendon to change. So no, absolutely, I don't think so. I think that there may be, you know, other issues related to general strength and things like that with the horse that may take you a little bit longer to get back. But no, we can always affect change on a living tissue.
Okay, we've got a question from Charlene, and I'm not 100% sure I know what this means, so hopefully you will, Kristin. What do you think of the Equisense or Equistick as for their measurements to help with rehab? Tell me what that is.
Actually, I had a slide in there about that, and I was like, oh, this is getting too long, and I took it out. But yeah, so I know Equisense. I don't know the other one that you're talking about. So they're the sensors that go on usually just the girth or the saddle pad, and there's a couple of different ones on which one you use. They are really useful tools, and particularly for measuring fitness, and they'll kind of give you a sense of general symmetry. So my understanding is, I haven't used one, so excuse me if I get something wrong, and please correct me if I do. But my understanding is a lot of the time they'll measure things like how much time you spent on each range, and they have GPS in it, so it'll measure things like speed and distance and things like that. And we did use a GPS tracker with Mr. P as well to monitor and measure our sessions. So I think it's a really great way to give you an objective measure of how you're progressing in your rehab. The one limitation of those sensors compared to the ones that I showed you is that it's just one sensor sitting on a saddle pad, so it can't give you information about limb symmetry like the one that we used did, because you don't have the sensors. You'd either need to have sensors on the pole and wither and sacrum, or you need to have sensors on all 4 legs to be able to get those measures. But certainly I think they're really great tools to measure a lot of those other parameters as well.
I understand what you mean now, because I remember when the one that came out in the girth, there was a girth one that came out at Equitana how many Equitanas ago was that now? If we get an Equitana again. Leslie has one more question as well. Did you make any changes to his feet? This is Mr. P, the rehab.
We did.
Yeah.
And again, if you're interested actually to know a little bit more about Mr. P, he has an Instagram page. Oh gosh, I got to remember what it is. I think it's Mr. P's Rehab Journey. We changed it recently, but you can always go to our Equimotion Instagram page, and it's in our bio as well. But there's a lot of videos on there from Aaron Stevens, who was our farrier, in what he did with him. So yes, he was kind of a bit of a typical thoroughbred, you know, very thin soled, quite NPA in his feet as well. So we did quite a lot of therapeutic shoeing with him. He was in, and not necessarily just for his tendon, but we did obviously take that into consideration. He was in a Eurobar shoe, so he had complete caudal support underneath his frog. So his frog was sort of completely, it's kind of almost like a heart bar, but kind of completely across the back of his foot. So his frog was fully supported by a shoe, and then he had impression material in that as well. And then we were doing x-rays of his feet, and we actually were also, we were wedging his left foot because, and it's interesting, and we talked a lot about this with Aaron, you know, we talked about he was obviously loading that left foot a little bit more, and we could see that in a lot of those pictures with how he was grazing with the stability pads. So, and he was quite sort of NPA in that left front when we did some x-rays. So we actually put a wedge on his left front and kept to kind of help with that as well. Yeah, so no, we did quite a lot of therapeutic stuff with him, which wasn't just in related to his tendon. It was sort of a kind of a whole holistic to do with his feet. But yeah, there's lots of videos from Aaron on our Instagram if you want to have a look at any of those.
So it does come back to, again, that circular care, that, you know, involving other practitioners who are, you know, really working towards the end result with you.
I think so. And I think, and our big MO at Equimotion is, and even Mr. P's, treat the horse, not the injury as well. Yeah. I think we can sometimes be so focused on my horse has a tendon injury or my horse has kissing spines and what treatment do I do for that? But we should really be looking at, well, what, you know, assess the whole horse and what can we be doing, obviously, yes, to treat the injury that we've got, but also to improve the horse as a whole.
Absolutely. It's been fabulous. Thank you so much for your time, Kristin. I hope everybody has enjoyed this and learned something. I know every time I talk to you, I learn something from you. And it's always a pleasure chatting to you. And as we say, you know, whenever we're recording for Horse Pro Hub, it's often the conversations we have off camera that are fascinating. We should probably just keep the cameras rolling all the time. So I think that's all for our questions, and I think we can probably, oh, hang on. Oh, please ignore the second part. Kristin's answered that already. Thanks. I think we can probably say goodnight, and thank you once again. We will be, we have actually recorded this. It does take quite a long time to upload the recording, so it will be available tomorrow by the time we have uploaded, downloaded, and put all those, and I'll send out an email to everybody with a link. So thanks everyone for joining us. It's been an absolute pleasure. And Kristin, thank you once again for sharing all your amazing knowledge with us.
Oh, you're very welcome. Thanks everyone for sticking with me for so long.
It was great. It was easy to do. All right, everyone. Good night. Thanks again, Kristin.
No worries. Bye.